Preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates. Once again, it is time to meet your provider with State of Franklin Healthcare Associates, and today we're talking to Dr. Brittney Terry. Doctor, thank you for taking some time with us today.
Thank you for having me.
Let's talk about your path, the journey you took to get here to where you're at today.
So I actually am from the area. I grew up in Roan Mountain, so about an hour and a half from here, and lived there my entire life. My parents were small business owners in Roan Mountain, and then I went to ETSU to undergrad, and then away to Virginia Tech to med school, and then back to Johnson City for my pediatric training, and then have been in Kingsport ever since.
Talk to me about why you decided, first of all, to get into medicine.
So I actually have always wanted to be a doctor. I have no memory of wanting to be anything else. Growing up, my best friend, her father was the physician in Roan Mountain. He actually was part of a rural health consortium that he actually came from Wisconsin to the area, and then they loved it so much they stayed. And so I remember even as a young kid, always being so impressed just by how much he loved his job and what an integral part of the community he was and how beloved he was by everyone. And so I remember being very young and thinking, that's the job I want. And then pediatrics was just kind of a natural progression. I really love children. I came into med school planning on doing pediatrics, and then I kind of liked everything actually as I went through, but ultimately kids were where my heart was, and so that's what I ended up settling on.
For Dr. Terry, pediatrics is definitely her calling, a calling that brings new challenges daily.
Every day looks different. It's kind of always an adventure. So, from right now, it's back to school season, and so we're doing lots of well visits with kind of a sprinkling of sick visits in too. And then as we get into winter, there will be more sick visits. And we try to always see all of our patients that call in within 24 hours. So how many patients we have worked in a day can vary wildly from day to day. And then a big part of our practice that really makes us unique is we actually have our own embedded behavioral health provider. And she's actually a PhD psychologist with lots of additional training in all things related to behavioral health. And so she really helps us make sure that we're taking the best care, the best evidence-based care of our patients from a behavioral and mental health standpoint, and is just such a huge asset to our practice. So we have a lot of that kind of throughout the day as well.
Promoting overall wellness in children is one of Dr. Terry's main priorities.
It's unbelievably rewarding. I mean, you really get to feel like you're part of their family. There's most of our patients, we know their siblings, we know their parents, we know where they went on vacation, we know who their teacher is. Kids love to be completely honest, sometimes too much so. And so we really feel like we get to know our patients very well and just be, I hope, an integral part of their childhood.
Away from her practice, Terry and her husband have 3 sons, and she truly enjoys wearing 2 hats as doctor and mother.
As a family, we really love traveling. That's a big passion of ours. We really love being super active. So one of our goals as a family is to try to see each of the national parks. So we're going to try to do that every year, every summer, until my youngest graduates from high school. And we're hoping we can fit in as many as possible. So that's something that it's kind of our bucket list family item. Dr.
Terry has done medical mission work in the past, and it is something she looks forward to doing again.
So in medical school, I was able to go to Kenya for 2 weeks, and then Honduras twice, once for a week and once for a month. And especially during the month-long mission trip, I feel like I really got to be more integral in their village and their community and really see what their daily life looks like. And it's a humbling and rewarding experience on a different level than practicing medicine here. You really can't understand what that's like until you've been there. So that's something I really want to try to do with my kids as they get a little bit bigger, and that's more feasible.
And as she looks to her future in medicine, Terry wants to remain in this region, providing the daily care her patients need for many years to come.
I'm hoping that I'll get to be here and keep doing what I love for as long as I can. I think that the future of pediatrics, hopefully won't change too much as far as what we do on a daily basis. Maybe things like value-based care and those things coming down the pike may change how insurance reimbursement works, but hopefully as far as our jobs, we'll get to still do them the way that we do now.
The care will always be there.
The care will always be there.
Yeah. All right. Dr. Brittney Terry, thank you so much.
Thank you so much.
That's this week's conversation in Meet Your Provider with State of Franklin Healthcare Associates. The preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates.